request Dr. Rahul Reddy sir to start the presentation. This is an interesting topic for both medical fraternity and non-medical fraternity. I think many people will be interested in knowing what is happening in endocrinology. So, coming to the topic, erectile dysfunction is not a single word. So basically we call it as sexual dysfunction. So erectile dysfunction alone is not the symptom. Sometimes it can coexist with premature ejaculation. So we have to categorize sexual dysfunction into two parts. One is erectile dysfunction, second one is ejaculatory dysfunction. In erectile dysfunction you have hormonal, different types of erectile dysfunction, hormonal, psychogenic, situational, vascular, neurogenic, and ejaculatory dysfunction, situational anejaculation, retrograde, premature ejaculation is the common type of ejaculatory dysfunction. But many people they confuse premature ejaculation with erectile dysfunction. But if you notice here, probably 20 years ago, when we thought of erectile dysfunction, the only word we used to hear is impotency. That word is not here. The reason for that is basically there is no impotency. Now there is only erectile dysfunction, sexual dysfunction, and infertility. So what that means? So any type of erectile dysfunction, there are 5 types of erectile dysfunction. All these can be treated, either with medical treatment, counseling, or surgery. All this, there is a solution for everything. So that is why the term impotency is outdated. And who can treat this? Do you need a urologist? Andrologist? No. Any doctor, any MBBS doctor can treat. Any MBBS doctor can treat. That is it. But what is happening? This is what happening. They are our computers. If you see the first letter, don't request me immediately if you have done any mistake in childhood. This is the fear. This was induced into the youngsters' minds in last 20-25 years. Okay, 20 years ago, we didn't have any treatment till the Viagra Silina came into picture. So till then, we used to depend on all those several medications. Then there was treatment. Now what they say? Don't take Viagra, you get tired. Now they are starting inducing fear in a different way. Now, if you see the first letter, if you have done any mistake in childhood, basically they are telling about masturbation. So even now, I get a patient of 60 years age, he comes to me with erectile dysfunction and says, Doctor, I did a lot of things in childhood, that is why I got erectile dysfunction. When I ask him, since when you are having erectile dysfunction, he says 1 year. He must be having diabetes, hypertension, cardiovascular disease, but he thinks that his childhood masturbation caused this erectile dysfunction at the age of 60 years. So that is our present status. We can use some drug, we can ask them to perform, but they don't have a partner now. Now how to treat them? How to take them forward? This is a difficult field to treat. They need a lot of counseling. We have to spend some time with them and counsel them, and we have to prepare them and push for marriage. Then how my way of treating is, I tell them, see, since you don't have a partner, I can't treat you, but I can get you really good early morning erections. Probably you should get confidence by seeing good early morning erections. You masturbate, you check how you are getting your erection, then come back to me before marriage. My assurance to you is, I will make sure that you won't fail during the first time. Then only they will listen. Coming to second category, married men with cooperative partner. This is easiest category to treat. Just give them some drug, they are very happy. Whether it's Challagali, they are very happy. And third scenario, marital conflict are complaining by most difficult thing to treat. Most of them, they will end up with penalty. Because sometimes, in spite of taking medications, that fear of failure or fear of heart learning, that will dominate the action of drug. I have a 60-year-old professor who was planning to marry his student. First wife divorced. So he came to me and said, "Sir, give me some regular kind of prescription." I said, "So, for what?" I said, "I'm planning to marry again. I wanted that." I given medication. Then after 3 weeks, he came to me. "Sir, I was about to die. Luckily, I came back to the clinic. Not because of medication." He said, "Sir, I went with my partner. So I took 100 milligrams. It didn't work. So I took another 100 milligrams. It didn't work. Then he took another 100. So finally, he has taken 300 milligrams of diet. So it didn't work. Then he has taken Pepaverine. He has taken Pepaverine injection into his legs. So finally, altogether, he was almost had a cardiac issue. Then admitted in ICU. Then came back. So only thing is, this category is very difficult to treat. Then it's better for them to have an implant or proper counseling session, or the partner should be treated counseling partner. And last one, 55 plus age group, people are without comorbidities, it is also easy. You don't have to cure them.
Mostly it's something we are very delicate because in medical council also we are seeing a lot of antibiotic going on in this sexual medicine. We have a lot of stigma and a lot of aphrodisiacs going on. We need more of this awareness among the medical professionals also because a patient comes to you and a pediatrician, patient comes to you and says, "Sir, wherever you go, you meet him, he says, 'Sir, I am your patient,' but not your patient. You meet any of your patient, he doesn't come to you and say, 'Sir, I am your patient' in any of the social functions also. So that's a stigma going on. So we need more of such kind of awareness going on, so that a lot of these social problems also can be solved because of this, and simple procedures and better awareness keeps this quackery in the social, in sexual medicine also to the minimum. Thank you, doctor. Thank you for inviting me.
Thank you, Rahul Reddy. As rightly pointed out, it's an interesting topic, a very good insight into it. And as rightly said Dr. Seshwanath, the only answer to this erectile dysfunction is hidden, that's the impression they have among the quantity part of it. So there's a need to go forward, covering that and removing that need. And how about any particular profession find more vulnerable to this problem? Any particular profession?
I think IT community, because most of them are into night shifts, they are more prone, but it's not for everyone.
So the take-home message is more of counseling. I mean, apart from this neurovascular and hormonal causes, psychogenic factors, the more proper counseling is a key factor in treating the patients. You mean?
Yes. And we are actually working with, we are starting training programs for doctors. This is not an analogy course. This is basic training program for MBBS doctors, and we are actually developing small kits, the related kits, where MBBS doctor don't have to worry about seeing doctor. Most of the physicians, I think, the major risk what they see is the moment they put them on cisplatin, they are worried about side effects. When patient is not worried, most of the doctors are worried about the possible side effect. So what we are trying to do is we are trying to make some kits, medication kits like package, level 1 package, level 2 package for erectile dysfunction, level 1 package for premature ejaculation, combination kits for erectile dysfunction premature ejaculation. So we are trying to treat if any MBBS doctor who is interested in this practice, then we help them in starting their practice and we train them, and we are actually planning to take IMA help for this.
Thank you. Any questions from the audience?
Now that awareness is already come, sir. Most of them are not using that.
There is a
Yes. Heat impact is there. So testicular that will increase the testicular temperature. Increase in testicular temperature will decrease sperm production and testosterone.
Thank you.
Thank you, Dr. Kumar, Challagali.
Dr. Ramana sir. Dr. KVC sir. Thank you, sir. I request Dr. KVC sir to hand over the mementos to chairpersons.
So, one second.
Chalo.